The Trump administration made headlines this week by changing the agency that hospitals will report COVID-19 data to, from the Centers for Disease Control and Prevention to the Department of Health and Human Services. Now, a lot has been made of this decision, and our political analyst, Dr. Brian Calfano, is joining us on the show now to tell us more. Brian, great to have you here as always. So what do you make of this news?
John, good to see you. You know, I make of it that the president likes the outcomes that look good for him and that put him in the best light. And I think what this suggests, even though the CDC has been correctly described as the crown jewel of public health agencies across the world, I mean, it is the best in what it does. The folks running the CDC, from Director Redfield on down, are career bureaucrats. They're folks who are going to be in their positions as researchers and as public health administrators long after the president's out of office, be that beginning of 2021 or 2025, whatever ends up happening, but they're going to be around for a much longer period of time. The president doesn't really have the kind of confidence in the CDC administrator to essentially have his back as the president and keep the president looking good in terms of downplaying the severity of the COVID threat, I think, as the White House has been trying to do for a variety of reasons. And the president just has much more faith in the appointed officials that are running HHS. And if you're looking at this politically, rightfully so, as the president wants to have people around him who will do what he wants as the chief of the executive branch. But if you're looking at this from a public health perspective, and from the perspective of whether your family member or your friend is going to end up coming down with COVID and have some very serious repercussions, this might not be the best of ideas to essentially play politics to a certain extent with COVID and with these infection rates, and essentially being in the dark with 50 different approaches to handling this pandemic, which is essentially what we've got across the country right now.
Would you consider this move by the president to do this unprecedented during a pandemic like this?
Well, there haven't been that many examples of this sort of situation, thank goodness. I mean, there have been pandemics before. Generally, the president accedes to the wishes of the CDC. Again, the CDC being the long-standing gold standard for this sort of thing. HHS being the oversight department for health and related issues, but the CDC was really where the specialists were. So if you were in the executive branch, if you were governor somewhere, or you ran some kind of agency at the state or local level and you needed insight or input, you went to the CDC. The CDC would put out recommendations all the time about various issues, various diseases and infections, not just COVID, obviously. So there really hasn't been a ton of cases where a president has said very, I think, strongly that, hey, we're not going to follow the CDC as the lead agency on this. We're going to move this over to HHS, which, again, that's the president's prerogative. I mean, he is the head of the executive branch, so he can make these kinds of decisions. What I think people miss, though, is that going back to the beginning of the 19th century, the 18 teens, essentially, states like Massachusetts were already going with mandatory public health campaigns. Back then, it was in the form of mandatory smallpox vaccinations. Smallpox, by the way, has a mortality up to about 30%, and it tends to scar all the folks who are remaining as survivors because of those smallpox that end up creating all kinds of issues with one's health, skin health, can cause blindness, all these sorts of things. And before there was a vaccine for it, there was lots of trouble. It was almost uncontrollable in terms of when it would flare up. By the time you had these vaccinations that could come along, you ended up getting a possible way to control what was going on. State and local governments at the time saw this as being a necessity. So I mention that to say that all of the controversy over the local masking ordinances and all of the concerns about our rights being taken away and all the other sorts of things you hear from a particular side in this debate regarding COVID and preventing the spread, this sort of thing has gone on for a long time. There was a landmark Supreme Court case in the early 20th century, Jacobson v. Massachusetts, because again, Massachusetts was sort of leading the way in requiring mandatory vaccinations for people and not providing for any kind of exemptions. And this went all the way to the Supreme Court, and the Supreme Court said, no, the states have the right to ensure that their citizens are as safe as possible. And if that means vaccinations, that means vaccinations. The difference, though, those are state and local governments, not the federal government. The federal government has really been much more involved in terms of setting overall policy for standards in healthcare systems and also for funding a lot of the initiatives that we've seen at the state level in terms of getting prepared for the kinds of situations we're facing now with COVID. So there really, John, hasn't been the kind of case law in the courts to talk about, well, you know, is the president okay doing this? Is he right to do this sort of thing? It is unprecedented, but that's only because in a lot of cases, these issues have been handled mainly by the state and local governments going back to essentially the founding of our country.
And real quick, Brian, we have about a minute left. Do you think there's going to be any political fallout from the president making this move? I know it probably will not affect his diehard supporters one way or the other, but for people on the fringes, do you think this is any damaging whatsoever to the president?
Yeah, only to the extent that it can be shown that this has now added on another layer of vulnerability for people. If there's some kind of connecting of the dots with, okay, this went over to HHS, the CDC wasn't able to be tracking this as well as they could have been, and that ends up in people's lives lost, or it ends up in some mass infection somewhere that they can point to as saying that's because of what this decision ended up bringing to us. But in the absence of that, I don't think so. I think a lot of it's more like inside baseball for most folks, and they just want to have a competent government response to this COVID situation, and they don't really care where it comes from or who's making the different counts that go on.
All right, our political analyst, Dr. Brian Calfano. Brian, thank you so much for coming on the show today. Good to see you as always. We'll be back with more Ozarks Tonight right after this.